Hi, everyone. Welcome to Pediatrics To-Go. The year is 2026, and we're very excited to have you here. It's been a while, and we really appreciate you joining us to watch our podcast. We have come a long way, and we started the podcast in 2023. So it's actually 3 years already since we've been doing this, and it's been amazing. We've had excellent feedback, and we just want to say thank you for subscribing. If you're not a subscriber already, please go ahead and do so. We are on Instagram. We're also on YouTube and TikTok. And thank you for joining us. Today, I have a wonderful pediatrician who has recently joined our team in Lagos. And she's going to go ahead and introduce herself. And just wanted to say welcome.
Thank you so much.
Uwayei, please.
I'm Dr. Uwayei, Aiewerioghene, a pediatrician. I work at Pediatric Partners. And we're here to actually educate you on several topics. And I know that the information that we want to pass will be well received and acknowledged. Our aim is to educate and give information to our mothers so that we can be able, and once you educate and train a mother, you are educating the population. So listen attentively. Keep in touch in terms of your comments. We'll look forward to the comment session to be able to answer some of your questions. Thank you so much.
Thank you, Dr. Aiewerioghene. And that is actually important because that's how we get more content to give to parents.
Our mothers, yes.
So go ahead and put in your comments. Give us suggestions. We might not respond immediately. You put it in there, but we will eventually. So if you have questions, we're happy to respond. And thank you. So today we're going to be talking about fish odor syndrome. And sometimes people ask, hey, what is that? I haven't heard of it before.
Yes.
But actually it's a syndrome that has been recently described, even though it's been around for years. So we're going to be talking about fish odor syndrome. And do you know anyone who smells like fish? And that is a very important question because before we started, we were talking about people who smell bad. Yeah. So today, the other name for this is called trimethylaminuria. I had to pronounce it properly just so that you guys can, if you want to Google it, go ahead and do so.
People say it's a TMA.
It's called TMA. Yes, fine. TMA syndrome. Trimethylaminuria. Yeah. And the reason we're bringing it up today is because it's something that has been around for a while, for hundreds of years, decades, and it's only gotten more attention and more reviews in the last 30 years.
About that.
And it's actually where you have an individual that is clean. He or she has their bath every day, and at the end of the day, they still smell. They smell like rotten fish. And the funny thing is, it's the same chemical that causes this fish smell that in human beings gives people that smell. And it's actually a condition that is it's rare. It's a rare genetic disease, but when people have it, they don't know what to do. So at the end of the day, it's a genetic disease where there's a gene that's missing to help to form an enzyme, which is the FMO enzyme. The enzyme is called flavin monooxygenase 3.
Yes.
And it's an FMO3 enzyme that's missing. And what happens is trimethylaminuria is a breakdown product of food, certain foods. We're going to get into that in a minute. Foods. But when you're not able to, the body's not able to change,
oxidize or break it down.
Oxidize that chemical. It's a breakdown product of certain foods that contain choline and
lecithin
and carnitine. Yes, and when you're not able to break down that substance, you end up being it's that the trimethylaminuria smells, and then when it's not oxidized, it stinks.
Yes.
Once you oxidize it, the smell goes away.
The smell, because that oxidized form is odorless.
Exactly. So once you're not able to transmit that substance into the oxidized version, people smell. And everybody is nice and healthy apart from the smell.
Yes.
The reason we want to bring it up is because when your child has bad odor, the first thing you want to say, oh, you haven't had a shower, you haven't bathed.
Yes.
These are most times children are bathing, they are doing everything. They are going to the dentist. The dentist saying your teeth are beautiful. And then they're also doing everything that goes with hygiene, but they still smell. So the bottom line is, for children like that, what are the commoner side effects that we see apart from, if you have a bad odor, what do they complain about?
Most of children, they will be stigmatized. Yes. No other child will want to be, once they enter the room, others would
will run
find
away.
an exit.
Yeah.
Nobody wants to talk with them. So those such kind of children could be depressed.
Yes.
Yes, and it
so
can
we're talking
affect
about
their academics.
Exactly.
Yes,
We're talking
their
about psychological. That's
effects.
the main thing.
Yes.
Because if you have anxiety because your friends don't want to be near you, everybody
Yes.
runs when you walk into the room. That can be very,
very, very
heartbreaking for children, especially when the community, the teenagers want to belong. So when you don't
interact with other children and no one wants to interact with you.
Yeah, and if you're in the US, when it's time to go for the prom, you're a boy, you ask 5 girls and they say no.
No.
And meanwhile, your other friends all have dates and you don't.
Dates.
It can be
depression.
It can be quite. So the bottom line is, for the good news is that
it's manageable.
First of all, it can be acquired or it can be congenital. Yes. The mode of transmission, if both parents have the gene for this gene defect, it ends up that the children will end up getting it. And parents might not have the illness or any, they might not have the disease, but the children end up with it and it has to be dealt with. So what do we recommend? How do we diagnose it?
We would always say that you need to have a very high index of suspicion, first of all, when a child presents this way. For the fact that the child maintains good hygiene or the individual maintains good hygiene and still has this kind of odor coming out from the mouth or from urine or body fluids.
Yes.
So one has to have a very high index of suspicion. It's a rare condition and it's not commonly seen. But notwithstanding, genetic testing, being that we mentioned that it's a genetically acquired disorder. So genetic testing can also...
It's genetically transmitted, but it could also be acquired. Yes. And, from our reading for the acquired versions, usually if you have liver disease and kidney disease, you could end up having
because
the acquired
it would
version.
affect the enzymes, because those enzymes are produced in the livers and the enzyme will not be able to function as it's expected to break down the TMA to its oxidized form.
Yes, so those are the acquired forms. And sometimes if people eat too much of these foods, they can stink. So if you don't have a shower in the morning, you can have that fishy odor smell just because, especially if you've been eating those specific foods that cause the accumulation of this chemical. Now, what are the foods that cause the chemical?
We're looking at eggs.
Eggs, yes. And then fish.
Legumes. Fish itself,
because fish has the trimethylaminuria. And that's what gives fish their smell.
Their smell.
If you smell bad fish, you know that you're smelling trimethylaminuria. You see, we have to, it's a mouthful.
Link it.
Right. And then what else?
Then even
so
legumes. We've mentioned eggs, fish, legumes like broccoli, peas.
Cruciferous vegetables, right?
Cruciferous vegetables, that class,
And legumes. Some people ask, what are legumes? Your peas?
Broccoli, beans, cauliflower, cabbage,
and even collard greens.
Yes.
We don't use a lot of collard greens in Nigeria, but in America, collard greens, that's what people used to cook ewedu. Not ewedu, vegetable.
Over
greens,
there.
Yes. Or our Nigerian stews, people use collard greens. Because sometimes it's not easy to get the leaves that we like. But it's a good substitute. Yeah, so by the time we start to avoid all those kind of foods, that can help. But we're going to get there in a minute. So if it's acquired, then it's usually because someone has the dysfunction of the liver or kidneys. But when it's genetically transmitted, then you cannot... there's really no cure for it apart from avoiding those triggers, yes. So now let's go on to diagnosis. The diagnosis is usually urine tests. And if you have a ratio of trimethylaminuria versus the oxidized version. Form. If it's higher, if the oxidized form is less, usually, but those are specialized tests. So you have to go. I'm not sure that they have that testing in Nigeria. It might need to be sent abroad. Yes, but if you have to go to those special doctors that can help you, go to your doctor and they'll figure out how to get you tested for trimethylaminuria, especially if you have this issue. Now, the other thing is, once you've been diagnosed with it and everybody knows this is what you have, what are you going to do?
Mentioned the avoiding triggers.
Yes, avoiding triggers, like which is the foods. And then the other things you can do is you want to make sure that there's no other...
hygiene.
Yes, good hygiene.
Then differentials too.
Yes, differentials.
Make sure that this child doesn't have a urinary tract infection that could have an odor in the urine.
Because UTIs could stink. Also,
exactly.
bacterial vaginosis.
Bacterial vaginosis.
If your child has an overgrowth of bacteria in their vaginal area,
yes,
they could smell more.
That could present that way.
Yes, that could present. And then foreign body in the nose. Your child has a sponge. I talked about the child who had a sponge. If your child has a foreign body in the nose, that usually is a new onset bad smell. Check for our doctors, if you have a child coming in that stinks, check the nose first. There's probably a foreign body that has been there
for a while,
producing that putrid smell, and you can't miss it. So once you've ruled out other diagnoses, apart from that we've talked about, you want to just make sure that hygiene, like you said.
Good hygiene.
Good hygiene, very important. And then what else?
Use of acidic soaps.
Acidic soaps. Soaps that have pH of 5.5 or less. Those help with the hygiene. And what else?
Then we also mentioned some enzymes, supplements that could help.
Yes, what supplements would
help?
Like
vitamin B2.
Okay.
Riboflavin.
That's riboflavin. Okay, so taking your vitamins, that helps too. And then what else? Citrulline.
Citrulline,
activated charcoal, and chlorophyllin. So it's chlorophyllin. Yes. So if you do those supplements, you can get them you can ask your pharmacist, they might be able to get it for you. And then the other thing is getting a good psychologist or psychiatrist, because your child has been singled out for weeks and months and years just because of this bad smell.
Yes.
So you want to get a psychologist that will help them to get over the lack of self-esteem and all that has happened over the years to boost their confidence. So let's not, we want to we cannot overemphasize the importance of having a psychologist manage this condition with your child.
Exactly. Okay. So it's something that is it's rare, but it's an important information, because we have a lot of people in our environment with this.
Yes.
And once we
especially in the heat.
Yes.
I mean, we're outdoors listening to the birds and among the flowers, but sometimes, when people sweat, the body fluids that tend to carry this smell are your sweat, urine. When for the female child, when they're on their period.
Yes.
Menstrual period. Yes, reproductive fluids. And that includes any reproductive
vaginal discharge and all
that. Semen for boys.
For the males.
And then sweat. So we said sweat, even saliva.
Saliva, yes.
Yeah, and then when your breath. So when you do things like exercise, you're producing more sweat. When you're stressed.
Yes, stressors can make it worse.
Can make it worse, yes.
Can make it worse. So
and then having the period, when a child is on her period, that can make it worse too, because the blood that's coming out of it stinks. So let's take care of our children properly. Let's get this evaluated properly. And for our doctors, some doctors might just be hearing about this for the first time, because it's not something that we were taught in medical school. In fact, we were discussing, and it's with the medical maintenance of certification with the American Board of Pediatrics. It came up as a question, and that's how, and people were asking, and that's how we actually decided to talk about it today. So very interesting. So if you have any questions, put it in the comment section. Yes. And did we miss anything, Doc?
For now, no.
No, okay. All right. So thank you so much for joining us for this episode of fish odor syndrome. And if you know anyone who needs help with this, please go see your doctor, and they'll be able to evaluate you properly. The other thing that can help is antibiotics.
Antibiotics,
that's one of the treatments. And they said
flora.
It decreases the microbiome to decrease the production of the TMA. Yes. And for doctors, it could be, you could use a
flagyl,
or neomycin. Yes, and neomycin is used for people who have chronic liver disease to sterilize the gut so that they don't produce more ammonia. Yes, so amazing. All right, thank you so much, and we'll see you next time.
Thank you. Bye-bye.
Bye-bye.